All right. Good morning, everyone. Welcome to the November Brooklyn DD Council meeting. Glad you can all make it. Sorry to schedule it during a holiday short week. We will plan better for that going forward in the future. But glad you guys can be here. We should have a good meeting today. We'll have updates from OPWDD, IAC. We have a great presentation by Cynthia Stewart from the New York State Office for New Americans, and she'll talk about all the resources that they provide to people in Brooklyn and our field. And then we'll have updates and announcements from Brooklyn Family Support as well as MTA and agencies. So to get it started, updates from the Brooklyn Council. Hopefully you guys keep an eye on our website or on our mailing list. We have good committee meetings that go on throughout the month. And most importantly, we will be going back this year to an in-person legislative event. That will be Friday, February 6th. Our co-chairs of the legislative committee, Lucina Clark and Maria Willis, are busy planning that, and that has been the focus of their legislative committee meetings to kind of start rallying around that. Maria, I see you're on. I know Lucina couldn't make it. Do you want to give a quick plug for it and talk about some of the things you're working on for it?
Sure. Good morning, everyone. Yes, as Brian mentioned, we're going to be having a legislative breakfast forum on Friday, February 6th at Brooklyn College. We are working on finalizing all the details. We are scheduled to invite several legislators to the event, so we are drafting that letter for it to go out as well. We expect a good turnout, not only of legislators, but of families, providers, and individuals to be present. And we will have certain parents and individuals to speak directly in terms of their personal situation, to speak to the legislators, so we could bring that message across that we need their help to continue to fund services for our field. Did I miss anything? So we will give you, as the day come up, we'll have flyers for the event. So that also will be distributed and sent out.
Thank you, Maria. And I just
You're
want
welcome.
to touch on the fact that you will notice it's at Brooklyn College this year, just like our Family Support Fair. So it will be very different than our past legislative events in Brooklyn, where they were always held at a catering hall, restaurant type of setting. We have more capacity limitations in this location. So we can only allow 180 people. So it will be important that everyone who plans on attending RSVPs. And the other big thing, it'll be more run like a town hall as opposed to a full-on breakfast with what you guys were used to in the past at Gargiulo's. So there will be refreshments similar to the Family Support Fair, but it will not be a big sit-down meal event. It will be set up more like a town hall with a room with light refreshments, just to set the expectation now. But yes, we will set up an RSVP. We do have to limit it to about 180 people. So please make sure if you want to come, RSVP as soon as it goes out, get it to your families, get it to anyone you support. Because we will not be able to go over that limit just based on the restrictions in this physical space. And obviously more details to follow. Rochelle.
Yeah, I just wanted to add, I'm really excited about this. And the Brooklyn state legislative delegation is like the largest in the state legislature. We have a big responsibility to reach out to our state legislators to support us in the upcoming budget negotiations. And if we can get some of the federal legislators as well, that would be gravy. So, we really need to work on this because they need to hear our message.
Mhm. And again, we strongly encourage everyone to attend our monthly legislative committee meetings because you can help be part of the planning and help be part of the action items that will be discussed that day with our elected officials and with everyone that attends. Do we have any other co-chairs from other committees that want to plug their meetings or give any announcements before I move on to the updates? Don't see anyone at this time. Oh, wait, I just saw, I thought I saw someone from our Meaningful Day committee. But Debbie, go ahead.
I just want to let everybody know that I will be combining the Provider Family Information Committee report with the advisory because we shared the meeting. So I just want everybody to know I'm not sure if we're meeting in December, but I will get back to everybody once I know by email and let you know, Brian. Okay, thank you.
Thank you.
You.
Do we have anyone on from the Meaningful Day Committee that can give a quick plug?
Good morning. This is Melissa. The residential committee will be resuming their meeting in December, and an invite will be sent out next week.
Excellent. Thank you, Melissa. As soon as I get it, I will share it with everyone on the mailing list and put it on our website.
Thank you.
Just to speak on the legislative committee briefly, we met on November 13th and it was a productive meeting. We have approximately 28 participants, and basically we discussed the different questions that a parent or person can ask the legislator and how to have a conversation with them when they either go into their office or see them at an event. Our next meeting is scheduled for December 11th at 10 a.m. Thank you.
Thank you, Maria. And just to say this now, the general council will not have a meeting in December. But we'll continue to make sure we share information, and please attend our committee meetings. And you can always find all of that on our website, all the links, all the meetings, all the announcements on the website, and also on our Facebook page. All right, so at this point, I will pass it on to Nina for the OPW update.
Yes, good morning to everyone. I hope everyone is doing well. I have only a few updates this month, and I'm going to start with the regional office updates. Some of you may know that we had a transition in the regional field office. James Doherty, he was appointed as a director of regional field office, and then we recently hired Contessa Officer. She joined our team last month. Contessa will be covering waiver, eligibility, and front door functional teams within New York City. That's entails all the boroughs. And we also hired Jennifer Mueres Diablo. She's coming from the hospital system. She has tons of clinical experience, and she joined our team about a week ago. Jennifer will be working in the role of the bridge director, and she will support Region 3 and Region 4. She will be working with QMTA teams. QMT is Quality Management and Technical Assistance, where we provide supports for provider stability. QMT also covers Willowbrook questions, RFPs, LOIs, letter of intents that are coming to the regional field office. So Jennifer just finished the onboarding, and we are very excited to have additional supports in New York City. As you know, our region is the largest and busiest in the entire state, and within OPWDD footprint. Region 4 activities represent, I think, about 40% of all the activities that are within OPWDD. So with that, Contessa, as I said, Contessa is covering eligibility, waiver, and front door. Jennifer is covering QMTA. Michelle Giuliano, you've met her. I'm sure she will be covering crisis, working with the hospitals, ITOs, and helping agencies to transition individuals from non-OPWDD settings into residential programs. Michelle also does self-direction program, and I will be covering housing and development teams, hospice changes, and mergers. So that's the new work structure for Region 4, and we are very excited.
Will this be posted on the website, or will you be sending it out in writing?
We are sharing that information with the agencies, and So we will be sharing, and also actually Michelle will be out covering a fiscal team, and the fiscal team works with FSS, Family Support Group, and also we are working on FI, we cover the contracts. So Deborah, we will be bringing Michelle to your FSS meetings.
Oh, good. Except that we're not doing it in December.
Okay.
And what about Robin Mooney?
Yes. So Robin is our FSS supervisor, right? Siobhan, who was administrator over several teams, Siobhan retired this Wednesday after 31 years of service. And we're gonna miss her terribly. And but we also will be hiring new staff as soon as possible. Okay, and with the statewide agencies updates, as you know, self-direction evaluation was completed. OPWDD Central Office is working with various groups on recommendations. The information is posted on the OPWDD website. CCO evaluation was completed as well, and we're also working on improvements and addressing all the comments that were provided. Last month, I mentioned the RFP that went out for regional disability health clinics, and we're OPWDD, we were soliciting application for existing clinics providers who were interested to enhance dental services and improve physical space to accommodate people in wheelchairs, and to become more sensory friendly, and improving access to specialty physical health services and healthcare and healthcare services. So those applications, the deadline for the applications was closed on, I believe, on November 5th. Last Monday, OPWDD announced the age out LOI. This is for, we are soliciting application from OPWDD residential providers who are interested to expand their services and deliver residential and day services for young adults who are graduating from the residential schools. We are focusing in this letter of intent, we are focusing on the graduates 2028, 2030, as well as everyone who is in the school right now that they have graduated in the previous years or graduate in upcoming years, but they do not have a plan for transition back to New York City. And the eligibility for the LOI is, as I mentioned, the agency must be licensed by OPWDD, be in a good programmatic and fiscal standing, not to be on an early alert, and the agency must have HCBS license to deliver services, and they have to demonstrate experience with the services they plan to offer, and also the focus is to support culturally and linguistically responsive person-centered planning. And with our OPWDD key priorities is to focus on the agencies who have housing vacancies, and they will be looking for modest modifications. We can also work with the agencies who would like to, instead of consolidate, instead of expand, right? We will also be focusing our work with the agencies who would like to expand independent housing options, subsidy models, family homes, supportive apartments. We're looking to promote employment-focused day services, meaningful community activities, and individualized service designs, and ensure supports for individuals with complex and medical behavioral needs, including potential enhanced funding. So our last LOI was about 3 years ago, and we are currently working with the agencies opening up new homes and working with our team on transitioning individuals. So it's kind of a big thing for us, and I hope we will solicit a good number of the applications from the agencies, and the deadline for the applications are January 16. So I think I don't have anything else for today. So are there any questions for me?
Yeah, so there was a question in the chat for you. Well, first I have a question. So you said Contessa was hired to cover waiver and front door for New York City. Is she,
Yeah, and eligibility.
and eligibility? Maybe sometime in the new year we can get her to do a presentation for us,
All right.
specifically
Sure.
on eligibility and front door. I think a lot of families have questions or struggles with that, and I know we do it all the time, but we always get new families that pop on, and I think it would just be beneficial, and especially then people get to know her.
Of course.
So if you can let me know when that would work. And then there is a question for you in the chat. Indra had asked, why are children under the age of 8 being denied for OPW Medicaid waiver services?
Why children under the age of 18 are not eligible for OPWDD services? Because there is a DOH waiver. And we partner with DOH on, there is a children's waiver, right? And then also the child, is in the school. It means that there are also state education that is involved in planning services for children. But again, this is all, I would say it depends. It depends on the specifics, right?
Hello?
Yes.
Not under the age of 18, under the age of 8 years old.
Under the age of, I would say, so Michelle, she's covering waiver, and she's the technical expert, and I don't want to give you the wrong information, but you can send your question to me and I will pass it along.
Thank you.
Thank you. And then Jessica asked if you can share the information you talked about the aging out. If there's like anything specific that comes out that you discussed that you're allowed to put in writing, if you can share that so I can share it out.
That LOI went out to the residential providers, to the executive directors. So if you are from the residential agency, right, you can get that information from the leadership.
Okay. Thank you. Are there any other questions for Nina?
Yeah. Hi. Yeah. You know what I was trying to, I guess I was double muted. I also was trying to answer that question that Nina answered. We have an ADM that speaks concisely to that issue. So it's just trying to attach it to the chat. So I'm going to send you the link as well.
Lucy, this is about the need of services.
Reasonable indication of need.
Yeah, for children under 8. Yep.
Just general reasonable indication of need, ADM.
Thank you, Lucy.
Sure.
All right. Do we have any other questions for Nina? I don't see any. Thank you so much,
Yes,
Nina.
I have a question. It's Carlin.
Okay.
My question also for Nina, good morning, is why are children under 8 being denied for self-direction? That's a big one.
I do not think that this is accurate statement, but again, you can send your question to me and I will forward that for Michelle and other deputies to look for the answer. They are not being denied. You know, it's a blanket statement.
Yeah, they take it on a case-by-case basis. But Nina, so then can you just, for Carlin and Indra and anyone else, can you just make sure when you get a chance to put your email in the chat.
Yep, I'm going to do this right now. Thank you.
Thank you so much. All right. If no one else has questions for Nina or OPW, thank you again, Nina. Thank you, Lucy. I will pass it on to Kate from IAC.
And I saw Pilar arrived. I didn't know if Pilar, you had something. Did I see that in the chat that she?
Oh, that's okay. You can go, and then when
Are
we
you
get back to
sure?
other updates
All
later.
right. Pilar's my good friend, so I don't want to ever cut her off. Okay.
Appreciate it.
Good morning, everyone. Hi, Brian. Hi, everyone. Almost Thanksgiving. Pilar. I'm Kate Hoy. I'm from the Interagency Council of Developmental Disabilities Agencies. Just want to share a few updates with you if I can find the right tab. Just off the top, an advocacy note was shared with Brian and other providers last week. Shelley Mayer joined a meeting that we participated in, and she had some advocacy tips for us. And Brian, I didn't know if you were planning to share these, but we thought we would share them with our communities. Is that okay? Okay. So everyone needs to have a personal relationship with their congressperson, state legislators, council reps. Senator Mayer really want to underscore the importance of ensuring that all of us are inviting legislators into our programs, seeing the magic, the everyday work and meaning of our programs. And just to reinforce that, we'll continue to ask everyone to do one clicks and to go and visit their legislators in their offices, but as much as possible, get them in the programs. Invite them out, let them see what's going on. We all know that we're going to be in a very tough economic position this coming state budget year. Our number one funding, all of our funding for the most part is from the state, and it's dependent on the state. So there are many threats to funding, and we need funding, and we need to make sure that they really understand the value and benefit of our programs. Going to Albany for lobby days, it's important. It's just not enough. So get your legislator's cell phone number, get their chief of staff's cell phone number, text them. We're not talking about spamming them. That is a crucial, critical difference. It's really about a real relationship and an invitation, right? We don't want to be texting folks to sign a one click or anything like that. That's not what we're talking about. We're talking about meaningful invitations to see the work that we do and the value of it. Just remember also, it really is a competition between our services for folks with disabilities and our, DSPs and staff and other Medicaid funded services. That's just the fact, right? So we will be in competition with other important services. It's going to be harder than ever. And just that they're going to be back after January 3rd, I think she said, around then. So, think about over the holidays, rest, relax, and then let's get back to work in December and really after the first of the year too. March 13th is the rally in the Valley, just to let folks know if you were planning to attend that as well. And there will be more lobby days coming up. Okay, so federal updates off the top. There was a DSP standard occupational classification bill introduced. I can put information about that in the chat. There is CMS guidance that was issued to states on provider taxes, which is a very in the weeds issue. But just to let folks know that CMS does have updated, the Center for Medicaid Services does have updated information that you can look at. Also, there was an informational bulletin issued this week, issuing a summary of the Medicaid-related provisions of the budget reconciliation legislation, or HR 1, or the One Big Beautiful Bill that was signed back in July. There's no new information in there, but it will also, the guidance document indicates that there will be additional information and guidance coming in the next few months to support the implementation. And we've been waiting for that guidance. CMS also has launched a website that will house all of its guidance and technical assistance documents related to the budget reconciliation, which they are referring to as the Working Families Tax Cut legislation. So I will put that in the chat in a moment. The government shutdown ended on November 12th. Everyone is aware. with passage of a CR continuing resolution to fund the government through January 30th. Republicans made a deal with a group of Senate Democrats to pass this continuing resolution, which means that it's those 9 funding bills were passed at the same budgetary level. There were no increases through January 30th. The deal made was that there would be a vote in December on the expiring enhanced premium tax credits for the ACA healthcare insurance, as well as important protections for federal workers, including reversing more than 4,000 layoffs that occurred during the shutdown. And of course, funding for SNAP. And that was a full funding bill. The agriculture bill was a full funding bill. So that's funded through September 2026. The CR also includes continuation of important health extenders from October 1st, 2025 through January 30th, 2026. So that includes the Medicare telehealth flexibilities, the acute hospital care at home waiver, the Medicare dependent hospital program, funding for community health centers, the Prevention of Medicaid Disproportionate Share hospital cuts, and No Surprises Act implementation. Each extender appears to be restored in a retroactive manner, including those Medicare telehealth services, which we know providers have been asking about. Although we are looking for additional sub-regulatory guidance, so please be on the lookout for that, and that may already have come through. So there was an agreement that appropriators are expected to work to pass the remaining 9 fiscal year 2026 funding bills through regular order before January 30th, right? Meaning that we don't want another shutdown. We don't want more chaos in government. We want appropriators to work together to come to a deal and to pass those remaining 9 bills. So just a little more on education. So education and domestic fundings for Medicare or Medicaid, those are all part of the Labor H, or Labor Health and Human Services Education and Related Agencies bill. Those, including IDEA and K-12 programs, those have been punted into next year. So I think, most folks may have heard last week that the Trump administration took the next step toward dismantling or at least significantly reducing the education department. The Office of Post-Secondary Education and Office for Elementary and Secondary Education, which oversees Title I for high poverty schools, critical for all of us in New York, all of our schools, teacher training programs, support for English language learners, charter school programs, competitive grants covering everything from art, education to civics. That will now all be managed under the Department of Labor. And the administration said that this is because the end goal of education, quote, is employment. It makes sense to have labor oversee K-12 education. So broadly, the idea is to show that functions of, what things that are being done by the education department can be handled elsewhere is the intent. And it's just important to note again and to underscore that the announcement did not affect special education yet. So Secretary McMahon has been on a press tour. She's repeatedly said in official and social and other media forums that the government shutdown shows how unimportant the Department of Education is. Essentially there was a government shutdown and kids still went to school. So what does it matter if we have a Department of Education? There's a lot of conversation about, well, could the functions of these important programs be handled elsewhere? And there's many arguments that I won't bore you before a holiday about why that is and isn't, accurate or right. We could debate it. And there's a lot of really good conversations you may, have already seen out there. But one thing that is deeply concerning is that this is happening without congressional oversight, and that there are statutory obligations for Congress to weigh in on these interagency agreements. And so what should concern folks, or what folks may want to, look into additionally, is that there should be input into these decisions, and that they should not just be done, through a press release, essentially. So there are folks who have all kinds of law degrees who are saying, this is a violation of the law. And certainly that is something that we'll be paying attention to. So we would recommend that Congress conduct oversight hearings. There should be an understanding, there should be more transparency about these changes. And of course, the Department of Education's changes are only one of many, many that have been rolling out. So I will share one click in the chat that we really do want to reinforce that legislators should be involved in these decisions and at least have an understanding of the impact, certainly to students with disabilities. And just to let folks know, November 29th is the Individuals with Disabilities Education Act. So I don't forget to put things in the chat. I'm gonna try to put them in as I go. November 29th is the 50th anniversary of IDEA, half a century of progress for students with disabilities, critical civil rights act. Anyway, let's take a moment to celebrate and reflect whatever you're doing on the importance of special education and the things and worlds that it's opened up for students with disabilities. Before 1975, 1 in 5 students with disabilities obtained any type of education. So we're not going back. Moving on to labor, just an alert or note that last week, a coalition of 56 Democratic lawmakers sent a letter to the Secretary of Labor condemning what they described as the most significant rollback of disability employment protections in decades. Lawmakers criticized the Secretary for proposing to eliminate key provisions of Section 503 of the Rehabilitation Act, including hiring goals, data collection, and enforcement mechanisms for federal contractors. And they also cut budgets for staff budgets for the Office of Federal Contract Compliance and Disability Employment. So the letter has requested, lawmakers requested a formal explanation by December 11th, 2025. So we will be looking out for that. But certainly if those protections and if any of that is relevant to you, and I think it's relevant to all of us, you may want to ask your lawmaker to get involved and let them know that it matters to you. State and city, there are updates on SNAP, which we've all been following closely, home energy assistance program, all of that. We'd recommend that you please go to Access HRA. There have been many issues with Medicaid recertifications. We've been hearing from providers and we've been hearing horror stories from families and many professionals. Please continue to reach out to, of course, your care manager and the CCOs, but also this is a real partner effort. We spoke with the Department of Social Services and HRA, and they have asked providers in particular to register for MARC alerts. They have asked that agencies send several staff members to attend what are called DAB trainings or disability aged and blind trainings. They're offered one time per month. It's a 2-day virtual training covering all aspects of Medicaid and contains really important updates that all providers and all care managers really need to know. They've seen a drop off in folks attending those trainings, and they say now more than ever, as things are changing, it's important to attend, but also it's a conduit to, it's a direct relationship to whenever things are going wrong, one way for providers to have direct access and ways to fix them. I will put the link to register for those. This is really for providers only, but I'm going to share it because we know that there's such an issue out there. That's for DSS, for the MARC trainings. Also for providers, please confirm that your agency is listed in the Access HRA app. I can provide more information if you're interested, but also if you just go to Provider Access HRA app, you will find a link to register as a provider so that you and the people you support can share information with each other. You can look up, ensure that addresses, dates of birth, recertification dates, you're able to see all of that. And we know that more than ever, as folks' information may have changed after the unwinding of Medicaid recertification. So we just want to get all of that fixed. Anyway, I think Nina went over a lot of the OPWDD updates. And so just to reinforce that the Guidehouse Self-Direction assessment final report was released. They provided 8 recommendations with a total of 32 activities to support them. Ways to improve OPWDD's self-direction program. The group surveyed included people who use self-direction, family members, CCOs, care managers, fiscal intermediaries, and support brokers. Both the full report and the plain language version of the report are available on the OPWDD website. Also, OPWDD will be releasing an update to the staff action plan, program and billing requirements. There is an informational memo 25 INF-03 informing providers of the requirement to provide information to people supported on the role of the Independent Intellectual and Developmental Disability Ombudsman Program. And the Justice Center has issued a new best practices toolkit on wheelchair securement and transportation. So we encourage everyone to use that resource as a tool in the safe transportation of folks supported and also QA/QI initiative. So, Brian, I'm sorry, I'm wrapping up. The NIDA Capital Rally was last Tuesday. Thanks so much to everyone who participated in that for your passionate advocacy. Really critical to show up and to be counted, and thank you. It was a really spectacular event. There will be more in the new year. Just to remind everyone of the NIDA advocacy priorities for this year, or for the 2026 state budget year, a targeted inflationary increase of 2.7%. 2.7 is that magic number. An infrastructure and care system investment package, which involves a whole host of capital funding, demonstration program, a prior property approval funding, right? Allowing providers to improve facilities, right? Residences, setting aside funds for capital repairs, renovations, things like that. That funding has been flat since 2016. And then importantly, a care force affordability initiatives. So affordable housing lottery preference for staff, employer assisted housing matching grant programs, capital funding preference for new child care centers at provider agencies, expanding the New York State child tax credit for DSPs and human service workers. All important affordability initiatives. Finally, in education, we are developing our asks for the new year. We'll be back in 2026 to talk about those and ask for your support and input on that. New York City, we have a new mayor. We're waiting to see who he chooses for school's chancellor. We'll also have a new council speaker, and we may have a new education committee chair. Not certain that Rita Joseph will stay on, but fingers crossed. Mayor-elect has said that early childhood is a priority. And just to let folks know, one of the things that we are watching from the perspective of our special education, preschools, and school age programs, the 4410s and 853s, are some of the initiatives that do not seem to include our staff. So the $10,000 increase, there was a hearing recently at City Council about this recommended $10,000 starting salary increase for paraprofessionals, which absolutely is a wonderful, important idea and policy priority. What it doesn't ensure is that teachers or teaching assistants, which is also a paraprofessional in 4410 programs or 853 special education school age programs, it says nothing about them also being eligible for that. So any benefits, any policy changes that importantly impact, our ability to recruit and retain teachers really must also include the 4410s and 853s. So we're going to need everyone's help in ensuring that everyone is eligible for those important bonuses. That's sort of there are a few other little things, but they have already been out there for a while. There is a new public-facing early intervention referral portal that we really want to make you aware of, and also for you to tell your communities about if you're not already aware. We do think that the Department of Health, and if Rihanna's here, we can have a conversation. We want to see more about this early intervention public-facing referral portal. It is new. I will put a link to that in the chat just to expand access and make the referral process faster for anyone whose pediatrician or if another provider wasn't able to make that referral. So we just want to ensure that things are not delayed. So I will put that in the chat. And then IAC, our lobby days are coming up in February. Education lobby days are on May 5th and 6th. We hope that you'll join us for IAC's 14th annual conference. It's on June 10th and 11th. And a very happy Thanksgiving to everyone. We're truly grateful for your partnership and for your community. Thank you. Hope everyone has a wonderful holiday.
Thank you so much, Kate. I know that was a lot of information, but Kate is great at covering all the bases. Good thing we record the meeting, so it will be posted on our website later today or tomorrow. So please, you can go through and pause on different parts. And Kate is always available. You can contact me. I can reach out to her. You can reach her directly if you have specific questions. I do just want to say, I know there's a couple questions for Kate. Just touching on the requirement now for the ombudsman program, how providers have to provide that information. I think the two easiest ways that I can recommend as a provider, one, put information about it on your website, and the other is add it into your grievance procedure, because every agency is required to have a grievance procedure that they provide to families about what is the chain of command when someone is happy or not happy with services. And one of the easiest things we did is you add it to that grievance procedure. It goes out to all families when they enroll. And then you update it throughout the year when you get it to them. So those are two ways that you should meet that requirement. So the first question, I see Carrie's hand is up for you, Kate.
Hi,
Carrie.
hi, Kate. How are you? That was a great presentation. Thank you. I have a I have a question about the portal for
Okay.
EI. Is that the only way that parents will be able to access the EI system?
No, definitely
Okay.
not. More roads, many roads, right?
Okay.
And that's the intent of this, is that through all of the existing referral mechanisms are there. In fact, providers would, many of whom we are, our members would often prefer that you go through them.
Yeah.
They want to have that direct relationship with you, with families. But still, folks are not getting the services they need in
Yeah.
a timely manner. We know that there are myriad reasons for that, primarily funding. There's a lawsuit that I didn't talk about that was filed. Rather than going on, we also, if there are referrals and if there are more documentation of folks who are waiting for services, not that this is the intent, but then at least it's public information. It's all public information, but yeah.
Great. Thank you very much.
Thank you. Yeah.
All right. Next question for you is from Rochelle.
Hey.
Hi, Kate. Thanks so much for so much information. But I want to go back to this whole thing about the federal budget and the shutdown, because my understanding is the key demand was really around the Affordable Care Act subsidies
Yeah.
that so far have not been renewed. And all they got was a promise that it would be discussed. However, I just did see an article where President Trump said he's going to come out with a plan for supporting the Affordable Care Act subsidies. So I don't know if you heard anything more about this.
Anchor is our national connection to a lot of the breaking news in the federal level. I have not received anything, but I will share that with you if I do get something, and maybe I missed an email in the meantime, but great.
Yeah, because what's true is while people with disabilities generally have Medicaid coverage, many of our DSPs are on the exchange and have
Yeah.
ACA coverage, and it's really important for them.
Amen.
So that's that.
Yeah, this is a true crisis.
Yes, it is. And it certainly wasn't resolved yet.
No, they exactly right. They agreed to hold a vote and no more. And really that was and in fact Speaker Johnson didn't even agree necessarily to that. Senator
he did not.
Thune. Yeah, so
No, he did
it's
not.
a deep concern.
Okay, so that's one thing. The other thing is something you said, I guess, stuck out for me, which is this thing about that we are in competition. I know Shelley Mayer said that with other Medicaid recipients. And I guess my feeling is that's not good. That's not a good tactic for us. Well, I think we have to talk about the particularities of what our supports our agencies and DSP needs. I think we have to start to think more about what we have in common with all the Medicaid recipients so that we can fight together. Because if we start fighting, if we are trying to be in competition with all the big players, we don't usually come out well. And in particular, I would like to think about the idea of access to health care. Medicaid recipients have the most limited access to healthcare services. Medicaid providers are getting fewer and fewer and fewer every minute that we are on this meeting. Providers are closing. Behavioral health providers can hardly be found. And it would seem to me that this is an issue of interest to every Medicaid recipient, whether they have disabilities or not. So I would just make an appeal for us to think about how we can ally together with all the Medicaid recipients in this matter.
First of all, yes. Second of all, if I misrepresented Senator Mayer, it is entirely my fault. Really, I think part of what she intended to convey, because your point is very well made and important, that we are, it's not just a zero-sum game, although it is a budget, right? So there are finite dollars that we expect to receive. However, what she's saying is, don't think that it's wonderful for folks to show up in person for lobby days. It's important, but when when folks meet at their budget tables and in their committees, there will be programs and interest groups that have conveyed their message more effectively, and that is a reality. They can't, right? And so that's really what she's saying is, you matter. All of those programs matter. And she did say they're all important. Just there's a reality to the advocacy that we do and who sticks out and when things are prioritized. But excellent point, and thank you. And please, it's the error is mine if I misconstrued that.
All right. We have two more questions. Can you guys be quick? Because we do have Cynthia waiting for our presentation. So first, Chris.
Brian, I'm always quick. Kate, it would be Kate, with all the information you're mentioning about federal, there has been Congress people have been attending the meetings, DD advisory. I just think that at this time right now, as they're giving out turkeys and food pantries, I think it's a good time to get them at the same time with their staff also. But Kate, when you get a chance, let's talk on the side.
And Winnie also, I know Brian, Brooklyn is a leader on advocacy. So whatever you're doing and the ideas that come through you, just let us know too.
PFT is charged.
All right. And last question for you, Kate, Debbie.
Kate, this is Debbie. I'm going to say something. I do agree with what Rochelle said, because I'm going to tell you, in the families that are on my council, they have multiple disabilities. And when I've told the elected officials that their parents have mental illness, physical health, I tell them how high the breast cancer rate is for parents with children with not just development, all type of disabilities, and that we all need to have the government funded well. And I've been saying this for years, and I'm going to say this. You never did, but your previous person made me act like I was a stupid idiot for bringing that up. I've lost, I don't know how many families I lost who had cancer between either in their uterus or their breast, and they died. And and I have never been acknowledged that I was correct. I've been made to feel like I committed a crime. But I'm going to tell you, I tell the elected officials that yes, my child has developmental disability, but I have different disabilities that need just as much help. And I bring up my late mother and my brother when they didn't diagnose kids correctly. So we need to start they are not just taking care of the child, they're taking care of the family unit too. So I'd appreciate
SMS
that.
From
all
your
right.
Son,
Thank you.
D. Grief.
All right. Thank you. Thank you again, Kate. And hopefully you could stay on for our presentation, but if not, have a great Thanksgiving.
Cynthia knows I'm a big fan of hers. So it's nice to see you. I will stay on for as long as I can. And thank you. Happy Thanksgiving to everyone. Excited to learn more from, Ona. Go for it.
All right. So now I am happy to introduce Cynthia Stewart from New York Office of New Americans. And she will be doing a presentation for you guys. So please, the only thing I ask is just keep questions for the end. And we will make sure we leave time that she can address as many as possible, or at least follow back up after the fact. It's all yours, Cynthia.
Thank you. Good morning, everyone. Grateful to be here also with my colleague, Liz Hradel. I just want to confirm that you can hear me okay and that you can see the slides. Great.
Sound good and look good.
Yes.
Excellent. So my name's Cynthia Stewart. Nice to meet you all and see some familiar faces again. I'm the Senior Program Manager for the Ramirez June Initiative at the New York State Office for New Americans, and I'll pass it to my colleague Liz to introduce herself.
Good morning. My name is Liz. I am the Central New York Immigrant Community Liaison here at ONA. I do live upstate, but when my family immigrated, we moved to Brooklyn, so this is kind of a little bit of a homecoming for us. So excited to be here today.
Great. So today we're going to share who are new Americans, what is immigration status, how does the Office for New Americans or ONA support immigrants in New York State, and how does ONA's Ramirez June Initiative increase access to services for immigrants with disabilities? So first of all, when we say new Americans, this term, it can be used interchangeably with the term immigrants to refer to all newcomers to the United States. New Americans are people who were born outside of the United States who've moved to the US to live here. And new Americans, they don't need to literally be new to the country. It can be people who've recently moved to the US, but it can also be people who've lived here for decades. And of course, some people who are new Americans are people with disabilities, including developmental disabilities. New Americans, like the term immigrants, can be used as an umbrella term for all people outside of the US who lives here, and that includes people with different immigration statuses and situations. Some of these immigration statuses include, but not limited to this list, naturalized citizens, so people who weren't born a citizen, but they went through the process and became a citizen, people who have lawful permanent residency, also known as green card holders, refugees and asylees, asylum applicants, undocumented individuals, and more. So why is understanding immigration status important, especially for supporting people with developmental disabilities? First of all, let's consider what is immigration status. Immigration status refers to the type of presence a person has in the United States. And immigration status affects new Americans in different ways. It affects eligibility for public benefits that are vital for people with developmental disabilities, like Medicaid and Supplemental Security Income, or SSI. Immigration status also affects an individual's authorization to work in the US, which is important for disability employment. And it also affects whether someone is lawfully present in the US at a given time. And keep in mind, you cannot determine someone's immigration status based on how they look, their culture, or the language they speak. And also, of course, immigration law is complex and ever-changing. Information that we provide, like on the slide, does not constitute legal advice. So consult with an immigration attorney for any law-related questions. And we'll share some resources on how to connect with immigration attorneys. So there's different pathways to immigration statuses. One's immigration status can change over time, just like the laws and policies often change, and we're seeing a lot of changes. An immigration attorney can consult with someone who, for instance, is undocumented or any new American in need to determine if they have a pathway to obtain an immigration status. So you can think of seeing an immigration attorney kind of like seeing a doctor for an annual checkup every year. If someone, maybe is not eligible for an immigration status or pathway, they might be in the future. So we have free immigration legal support and screenings through our network, and we have a hotline that you can call. These slides will be available after the presentation to connect with our resources. So a little bit about work authorization. So non-citizens, people who aren't US citizens, can be work authorized in the US, and many new Americans are authorized to work. So there's different forms of documentation that demonstrate authorization to work. Understanding work authorization can help new Americans to access employment services. So just some examples, the green card, which many people are familiar with, is evidence that someone is also legally authorized to work in the US. And then new Americans with certain immigration statuses are eligible for an employment authorization document or EAD card. And these are just some examples to keep in mind. It's not a comprehensive list. There's other forms of documentation, but sharing this information so that can help you in supporting people who are immigrants to access DD services. And then also, if you are a new American yourself, understanding some resources that are available. So there's also the I-94 form, I-94, that is given to refugees and asylees. And this is a work authorization through their status, but they can also get an EAD as additional proof of employment authorization. So this card, sometimes employers are more familiar with that versus a piece of paper. So that's an additional way to show that employment. These examples were developed through a training co-developed with the Office for New Americans, Office for People with Developmental Disabilities, and the Council on Developmental Disabilities to train care managers, including intake staff and other CCO staff, to understand immigration status and how it affects access to OPWDD services. So I'm sharing some highlights from it to share some of these concepts. But if you're interested in the longer version of the training, we'll go over more immigration statuses, happy to connect with that and offer that training. Just reach out to us and we'll share some resources in the chat after we're presenting. So I'm just going to spotlight the statuses of refugee, asylee, and asylum applicants. So refugee, well, one, how are these statuses different and how are they similar? So a refugee is someone who applies for protection from persecution before entering the US. And then refugee status is granted before that person enters the United States. After the person is admitted to the US as a refugee, they have permission to live and work in the US. Whereas an asylee is an individual who has already applied for asylum after arriving in the US or at the US border or at a port of entry to the US, like an airport. Individuals can also apply for asylum from within the US within a certain time period of entering the country if they meet certain criteria. And so I want to share, asylum applicant is different than an asylee in that where they are in the process. Once someone is an asylee, they've been granted asylum and they have different access to benefits. Whereas an asylum applicant is someone who is in the process of applying for asylum. And so you may have also heard of asylum seekers in the past year that you can think of that as an asylum applicant. Their ability to access benefits or work authorization depends on where they are in the process. So their right to remain in the US has not been determined yet if they're still an applicant for asylum or an asylum seeker. So I wanted to flag one policy. There's a lot of different policy changes at the moment. This is a long-standing policy that has been flagged as an issue for new Americans with developmental disabilities. So I wanted to raise awareness about this. So refugees and asylees have a hard 7-year limit to accessing supplemental security income benefits. So they can only, access those benefits for 7 years. For refugees, that 7-year limit starts once they enter the country. And for asylees, people who've been granted asylum, that 7-year limit starts once they get asylum status. Even if they don't apply for and use SSI until years later, they have that 7-year limit to access it from that status. So with this policy, and I'll share a link to the policy in the chat, refugees and asylees must become US citizens to keep or reinstate SSI benefits after that 7-year limit. So I wanted to flag that because for people with developmental disabilities, SSI benefits can be really life-sustaining, and this policy isn't well known, so it can be a surprise for people when their SSI benefits end at the end of that 7-year limit, and it can be a scramble if you're in a rush to become a citizen. That process takes a while. It can take years. So please keep that in mind. We'll share that link. So some takeaways about immigration status before we move on to sharing more about our office and our resources. So immigration status affects these different things like public benefit access, like work authorization. One's immigration status can change over time, and immigration laws and policies often change, as we see now. So assist new Americans with disability employment services and work opportunities, as well as accessing benefits that they are eligible for as needed. And when possible, connect new Americans, or if you're a new American yourself, in need, connect with immigration attorneys. Now I'm going to pass it over to my colleague, Liz.
Thank you, Cynthia. And I put in the chat our main webpage, which has all of our resources that we offer for our new Americans, as along with a link to sign up for our email notifications for webinars, updates, and more. And we have done a lot of webinars on these types of topics. So the New York State Office for New Americans was founded in 2012. It's the nation's first statutorily created immigrant services office. We assist all new Americans with accessing and navigating a variety of free services and supports through our statewide network of community-based providers. So I know that I'm in the central New York region, Cynthia's in the capital region, and you guys are down in the city. We cover all of New York State, regardless of where you are, how long you've been here. So this is kind of our wheel of what we offer: citizenship and civic engagement. So if someone is interested in pursuing citizenship, they're not sure if they might qualify, how do you sign up? What are the 87,000 questions on the form to do that? We can help with all of those types of things. We have workforce development initiatives. Mainly one of our primary ones is professional pathways. So when you get individuals who come over and they've worked with individuals with developmental disabilities, or they've worked in healthcare, or they used to be teachers, how can we retain them in those fields and get them back out into the workforce, utilizing the education and honoring the tacit knowledge that they've come over with? So if you're looking to work with providers, that's a really great program. We have mental health supports, and we'll talk about all of these things a little bit later, but our Golden Door program to support individuals who have those additional needs. We also work very closely with the Office for Mental Health on the different services that they offer. We have immigration legal services, which is very busy right now, as you can imagine. We have providers all over New York State who can assist with everything from family reunification, issues with the visa, and applying for work authorization. So if you're working with an individual who you're not sure if they qualify yet, or you want to start that application, or just have any general questions, our hotline is a great way to do that and get a hold of someone who can answer those questions for you. We have English language learning. We do this in a few different ways. We have in-person classes. We have, depending on where you are, virtual classes for different areas of New York. And then we also have a program called CEL-Ed that we'll get into as well. And then our disability services that Cynthia is going to cover in depth, because she is our expert on all things in-house for disability services with our new Americans. So our legal services, it's a statewide network of immigration attorneys who have experience, they've got the knowledge, they know how to answer all of your questions. Everything is free, regardless of your status. So that is not something that we take into account when we're doing intake, or when our partners rather are doing the intake. That doesn't matter how you got here, where you come from, we just want you to get the help that you need. We have consultation days available at ONA Opportunity Centers. You can go onto our website and see where the nearest opportunity center is for you. And we also host a plethora of Know Your Rights and law-related workshops. And then below we have our hotline, which we'll present a few more times. So getting into the English piece, the English language learning piece, we have CEL-Ed, and it's a mobile way to learn English. It's really fantastic for individuals who want to get some English classes in while they're waiting for their laundry at the laundromat, or while they're on the bus, while they're waiting for a doctor's appointment. It's these 3-minute stackable lessons. You can learn at your own pace, anywhere, anytime. You can measure your progress. And the best part about this is, unlike things like Duolingo, you can earn a certificate that shows that you've completed a certain level of English. It doesn't quite incorporate like the same as like a college credit, but it does have that certification to show, yes, this person has been working. We want to acknowledge their linguistic accomplishments. And they have a lot of different supports on there where you can call and get assistance if you need to. And it doesn't require any sort of internet access as long as you have cellular data. This is something that is accessible to anybody with a phone.
Thank you, Liz. Then another one of our programs is our Golden Door program, which is named after the poem that's on the Statue of Liberty, or associated with it. Our Golden Door program offers mental health support groups. So group therapy for immigrants across the state. It is available in New York City. So this is a way that new Americans can be connected with therapy. And then this program's free, as are all of our programs. So this is a way to connect with therapy, especially if people don't have health insurance, because this program's free. It's not through health insurance. And the therapy groups are facilitated by licensed mental health therapists. And for more information, I believe our website was shared in the chat. You can look at our different programs and where we have different grantees available. So then a little bit about the Ramirez June Initiative. Its mission is to increase access to disability services for new Americans. And I apologize for some background noise right now. It increases access to services for new Americans through outreach, training, and partnership. And the initiative is a first of its kind in the nation. It launched as a grant from the New York State Council on Developmental Disabilities in 2019, and we continue to build capacities to support new Americans with disabilities. So our CDD grant has ended, but we've continued the work as an essential part of the Office for New Americans. Since 2019, we've hosted 201 workshops, and which include presentations like today, which are also directly to new American communities and in different languages. Our workshops have engaged over 6,000 attendees. We've also distributed close to 6,000 copies of Voyage, which is a free resource book, which I'll share a little bit more about. A program I want to highlight that is local to you, it's located in Brooklyn in the Sunset Park area, is the ONA Bilingual Coordinator Program. This program is led by the Chinese American Planning Council, and it offers case management services to access disability services. So we partnered with CPC, Chinese American Planning Council, to help the local immigrant community navigate the OPWDD eligibility process. So this program, it's led by Chinese American Planning Council, but it's open to different immigrant communities who it intends to serve. So we hope that it can also be a resource for referrals for you. This program has also developed a resource guide of providers in New York State who speak Chinese languages, part of the disability system, different providers that people can access. And connects clients with disability, but also mental health services. And they have a focus on connecting people with OPWDD services. So for instance, they could help people navigate getting the different diagnoses. You need documentation of diagnoses to go through the process and filling out paperwork. They also host workshops on different disability topics. So a little bit about our resource book, Voyage, which is on the early identification of disabilities, and it's available in 13 different languages. This is a resource that we mail for free to anyone who requests it, and we have an order form, which I'll share shortly. So what's in Voyage? This has multilingual information on child development from 2 months to 5 years old. And each copy is bilingual with content in English and a second language. And it provides ages for developmental screenings and autism screenings starting as early as 18 months and other important visits, developmental milestones, and activities to support children's development. So the book's available in 13 languages, but we do have our order form both in English and Spanish. You can use either form to order copies of Voyage in any languages. And again, these slides will be shared afterwards. Now I'm going to pass it back to Liz to share a little bit about our hotline.
Absolutely. So one of the main ways that we triage what resources to go to is the hotline. You can see the number there. It is also on our website and will be provided in the slides that we will send you all. It is completely toll-free, doesn't cost anything. It is open 9 a.m. to 8 p.m. Monday through Friday, with the exceptions of bank holidays. Anyone can call for information and referrals regardless of citizenship or immigration status. The calls are private. We want to reiterate that this is very confidential. So you don't have to give your personal information if you're not comfortable. The two things that we really need to know is where you are and what you're looking for, just so that we know what resource to send you to and what provider is going to be the closest to you. And I also kind of like to reiterate that if you're a provider, you can also call the hotline and say, hey, I'm working with someone who's looking for this resource. Where can I send them? That is also a way that a lot of our providers or those who work with new Americans utilize the hotline as well. And then I also like to throw in that if you're noticing any immigration fraud or anything that kind of is a red flag for you, you can also report it, because the original intent of the hotline was to collect information on immigration fraud or providers who are maybe falsifying anything like that, or just kind of like consumer protection for new Americans. And then it turned into what it is now, which is kind of like a 311 for our new American resources across New York State. Assistance is available in over 200 languages, and information on the hotline can also be found on the website that we have. So we also have our Know Your Rights, Know Your Resources. This is an incredible piece that we've put together on the different rights that you have, everything from labor and human rights to all sorts of family resources and health resources. And so we'll include this in the chat. This will also be provided in the slides. This is a really great flyer to put in your workplace. I know that someone from the library mentioned they were looking for different resources too. And this is going to be available. It was just released very recently. I don't know if it was Friday or today, that this is available in multiple languages. So we will make sure that you get the link to this Know Your Rights page that is available in the top languages that are spoken across New York State. We are partnering with the AG's office to collect some information as well. They have a form that you can fill out regarding information on federal action. So we will make sure that these get to you as well.
Thank you, Liz. And I'll put that link in the chat, the federal action reporting form that we have linked on our website. I'm going to share that. Also, if you can, please take our survey to share feedback. This helps us continue the work that we do, and it's great to hear feedback from you. I see some great questions in the chat. Would love to address them if there's time. So yes, if you want to open the QR code and enter the survey now or when you can, also share the link afterwards. I do have some discussion questions, but I'll pass it to Brian in case we have time to answer any questions. Thank you
so first
much.
of all, thank you so much, Cynthia. Thank you, Liz. We greatly appreciate you being here and setting up time to get this out there. There are a couple questions in the chat. We definitely have some time if you want to go through them. But I think overall, this was a great presentation, great resources. And as you mentioned, you will share the presentation with me. So for everyone that is interested, when we post the recording on the website, this will be there. I did put in the chat that flyer that was just shared, the Know Your Rights. That was already sent out through our mailing list. It's on our Facebook, it's on our website. And I can certainly share it again. But as soon as your office shared it, I sent it out to the mailing list right away. I have one question and then we can go through the chat. I know for the reporting, there's the anonymous option. Do you find that most of your reports are anonymous just because of everything going on today? People are afraid to call in and get support and ask questions and disclose what they're going through because they feel then their status will be put somewhere and they're more of a target.
So the reporting form goes to the Attorney General, but I can't speak to the main part of the question, but I would just say that there's increased fear among the communities, and we've heard also from other state agencies, just people afraid to go to the laundromat, afraid to go to university, afraid to bring their kids to school. So, and just even some outreach events, taking care. I think something to keep in mind if you're engaging communities that are at risk for deportation or detention or just at risk for those actions, just thinking of the privacy protections for them.
Yeah, because I feel like that could hold some people back from reaching out to your office, just the fear that even though it says anonymous, with everything everyone's seeing on the news these days, there's an increased fear. And people are afraid to disclose that they're an immigrant and need help and looking for things. So just throwing that out there. But like I said, there is time for questions. So Chris, I see your hand up, but give me 1 second. I saw there was 1 or 2 in the chat I want to get to.
Read the questions first. I'm waiting.
Thanks for your permission. Pilar had asked, for children who have developmental disabilities and their parents are applying for residency citizenship, This poses a big challenge for those who would transition out of the DOE services and need OPW to receive adult supports, as they have to be enrolled in the Medicaid waiver. How can we advise schools on how to support their students in this situation? Is there a form of probational approval they can receive while awaiting residency status? What is OPW or your office's response to this issue?
Okay, great question. Cannot speak to OPWDD's response on that. And I think just in general to keep in mind, so, what I can share, the technical assistance that I can share is that, the type of benefits someone can access like Medicaid, it doesn't depend on, when I talk about backing up a little bit, talking about eligibility, I'm not talking about like needs factors like, income or health-based needs. I'm talking about immigration status and how that affects eligibility. So, if your parents don't have an immigration status, like they're undocumented, but the child is a US citizen or has a different status, a child's eligibility for public benefits depends on their immigration status. So just repeating that, like someone's parents, their immigration status does not affect their children's access to benefits if the children have, a different status. So if in that case, the child is a US citizen and they have full access to Medicaid, or they could have many other different statuses where they can access to Medicaid, that would go through the child. So there are some changes, proposed changes to Medicaid access, but right now, a resource I use, I just put in the chat, is the New York Immigration Coalition resource, which lists out, it's a chart and it lists out different immigration statuses and whether they can access Medicaid, New York State Medicaid, or federal Medicaid. And the statuses where it says that they can access Medicaid, whether it's New York State or federal, they can access OPWDD's Medicaid waiver services. The one caveat is that undocumented individuals, don't have access to Medicaid, except for certain situations like emergencies, pregnancies, and if they're 19 and under or 65 and older. For those undocumented who are 65 and older and can access Medicaid, that Medicaid's not comparable with the OPWDD system. So that's a little bit of information. I don't think I got to everything in your question or that I can speak to it, but I would advise the schools to see what resources they can access to better understand immigration status and access to Medicaid based on what the children can access. And if the children are undocumented and can't access Medicaid, to advocate for them to access OPWDD's state-funded services. State-funded services can support undocumented people, and there are also instances for undocumented people with developmental disabilities where they have been able to access services that would normally be federally funded through state dollars, but that involves a lot of advocacy and can be rare, but sometimes when the needs justify it, that does happen.
Cynthia, did you also want to mention the upcoming webinar that we have for the N6?
Yes.
Yes.
Thank you for the reminder on that. So we have a link to sign up for our email announcements. So we have funding opportunities, different announcements that go out, and also monthly webinars. And in January, we will have a webinar on the N648 form, which is a medical accommodation to naturalize. So if immigrants with disabilities, they have different disabilities that make it difficult to do the civics test, part of naturalization, or to do their interview in English, there is that form for accommodations, but it's a very difficult form, and it's, there's been changes to that form this year. So we have a webinar with an immigration attorney presenting on that in January.
And it will be recorded.
Yes.
All right, great. Thank you. So now I don't see any other questions in the chat, so I'll go to the hands if that's okay. Chris, your hand was up first.
Yes, Liz, and I'm sorry I can't see the other name because my screen is a little different. I have to say it was a great presentation that when you're explaining about disability. And I have to say I left some information into your chat boxes, but also what I'm seeing lately is, and I might be wrong on this, but I'm going to play the safety net. as you know, right now we have these agencies, other agencies that are not with us outside, don't check if that person has a disability. And we're talking about state and federal. As those enforcers, are they trained to help people with disabilities or see if they have a disability? Because not every one of them are properly trained or not show the courtesy and respect. I have seen state troopers, I see our NYPD, I do see some National Guard are working with us, but there are some other agencies lately I just think they're lacking on training on disabilities. Do you see that? And just to let you know, we as Brian deals with, we also work with the New York City Department of Human Rights. We just had a presentation this past Tuesday, which is Equal Totals here, on human rights. So we do have a relationship with them as well. Thank you.
Thank you. Could you clarify, were you also talking about immigration officers or police officers, like law enforcement?
Let's say immigration officers, and I didn't say police. I just said law enforcement
Okay.
because it could be the one you just said. It could be ICE. It could be any kind of officer. But I did say it wasn't NYPD, wasn't New York State Troopers, and it wasn't MTA Police.
Okay. When I say immigration officers, I guess I'm referring to people who do the interviews to go through the immigration process, not immigration enforcement officers, like ICE or Customs and Border Patrol. So we're talking about like if someone's going through the naturalization process, the immigration officer doing the interview. So I'd say it really depends, but that there are there's the N648 accommodation, but there's other accommodations to go through the naturalization process. And I would say that it would take some advocacy from the individual or people in their support network to make sure those accommodations for the naturalization process are offered. There's a website, so USCIS, United States Citizenship and Immigration Services, they do have on their website where you can request accommodations, and they do have a disability office. So if you make the request on the website, then you'd be in that system and you can reach to them to technical assistance. I can't speak to capacity, but I think know that there are accommodations and that it may take some advocacy that those accommodations are given. And then otherwise, I can't speak to disability training for law enforcement from my personal knowledge. I don't know if Liz, if you wanted to add anything there.
It's something that's kind of been in the bigger picture outside of just for our new Americans disability training. I know that a lot of municipal, like very specific municipal areas, like in the city of Syracuse, everyone that goes to the police academy here gets training on working with individuals with disabilities, and that covers a whole scope of disabilities, whether it's physical or cognitive. But after that training, I'm not really sure what happens, if it's annual or not. They may not. It's just not something that's been in my purview specifically, but that's definitely something that we could look into. And I would encourage you to reach out to your elected officials and maybe your local county sheriff and advocate for those types of things. It's tough because we don't necessarily have the authority to kind of push those requests out. But I did want to bring out another resource. Speaking of access to services, there's the New York State Office for Language Access, and that is they offer best practices for translation services and accessing government services. So all state services, separate from the federal government's authority of what they've done with translation services, New York State still requires everyone to all of our state agencies rather to offer everything in languages that the individual needs to access whatever that service is. So if they need a form translated, if they need a translator on the phone when they walk into an office, what are the best practices for translation? Person first language, which includes individuals with disabilities. All of those things can be found on their main webpage. So I'm going to put that in the chat. So at least we have the security of that, and they offer some really great information on there, including ASL, language access rights in New York State, language access laws. You can take a look at those. They have a directory, dashboard, community engagement and collaboration. And this is something that's really great to get your organizations involved in and advocate for. They are a separate agency from the Office for New Americans. So they're their own state agency, but we work very, very closely with them to get information out to provide what are best practices for translation. I know that they have a forum for individuals and agencies who are 501c3s to access the same, to kind of tag along with our contract for translation services. There's a way to do that. I'll see if I can dig that up so that the cost that we pay for translation services gets shared with you at that rate. And that might be a way to save some funding, based on what's going on. Again, that would be a question for the Office for Language Access. That's not something that we oversee. But I kind of always like to point everybody in their direction because they have really great stuff, particularly because we know that some of the challenges that individuals face who come over who are New Americans with disabilities is learning a new language. That's extremely difficult, and we consider that a compounded problem. And this is one more way that we are able to serve them.
Thank you.
Thank you so much. And there's another question from Paula.
It's more of a comment. Thank you, Liz and Cynthia, for this wonderful presentation, and from the New York Lawyers for the Public Interest. I believe our immigration program often refers to your office and sometimes collaborate with your office. I want to speak to the point of the OPWDD eligibility. I know Cynthia spoke about it, but for the audience, people, immigrants, could apply for these services. I actually put in the chat a fact sheet that we created because we often get those calls and New York Lawyers for the Public Interest. So if you have a person who is, it typically is a student with disabilities who is in the education system, and then it's time for them to graduate and transition to the adult system, and many, many times the schools do not know that it's a student is able to apply for OPWDD services as well, even though they could be undocumented. So the fact sheet is there in the chat. Please grab it from there. If you have any questions or if you want, further information about that, feel free to call us and New York Lawyers for the Public Interest. We often, talk to families about this particular issue. So thank you.
And just so you guys know, I do have you guys linked on the Brooklyn Council website, and that I also just linked the language services website that you shared as well. But that way, when people go to our resources page and are looking for resources that can support them, you guys will be up there so people can find you a little bit more easily. I don't see any other questions at this point. So thank you guys both for being here. It was a great presentation. It'll be recorded. People may reach out after the fact as they watch the presentation, but you guys are welcome back to join us anytime, and please keep sharing information with me so I can share it out to the group. And if that's it, I think that's it. I don't see anything in the chat either. I was just looking.
Thank you so much for having us, and thanks everyone for your great questions and discussion. Please reach out to us and consider Office for New Americans as a resource to support you.
Thank you so much. All right. Moving on. Debbie, you want to give your update?
Thank you, Brian. Good morning, everyone. I'm doing the report not just for the advisory, but for the family provider information, because our speaker that was supposed to be did not show up. So I said, please come with us, because we did a meeting with David Rosio. He is from the New York City Human Rights Commission. He gave a really great presentation. He explained our report will be online with this minutes. It was already put on, because he explained how it works with people with developmental disabilities and people without developmental disabilities. And he gave us he did a great hour's presentation. Now, I just want to also let you know that the Advisory Council is not meeting next month. But I will also tell you, there's 3 things coming up. We will be having one second. Okay, wrong one. Sorry. Okay. We will be having our regular, usual Developmental Disability Resource Fair Friday, December 5th from 11 to 1 p.m. and that'll be at the Mill Basin Library. The address is 2385 Ralph Avenue, near Avenue N. Now we will have different speakers. We have different agencies. If you come and we don't have enough room or tables for you, we still want you to bring your information so it can be shared with everyone. And I want to thank Carrie Banks from Inclusive Services of the Brooklyn Public Library, who's been partnering with us. Our next, in January, it's going to be at the Homecrest Library. That's 2525 Coney Island Avenue at Avenue V. We have all the directions to be. Also, on Wednesday, January 10th, is the New York State Family Support Service Advisory Council meeting. It will be from 11 to approximately 3. Links will be put out so you can watch it. I will be at 25 Beaver. You can come in person to watch. And I also suggest sign up for any form of sign up for the public session to speak for 2 minutes on any issues, whether it's issues with reimbursement, any other family support services. It's very important. They need to hear from you. So with that, my council would love to wish you all a very happy Thanksgiving and happy holidays. We'll probably see you next year unless we see you at the resource fair. In reference for the Information Provider Committee, I'm not sure if we'll be meeting, but I will make sure that I speak with my co-chair and Brian will get the information and then we'll put it out on both websites. And the Brooklyn Advisory's website is www.bfssac.org. Thank you.
Thank you, Debbie. Chris, do you have any updates MTA wise?
I do, Brian, because there is some concern. And before I do that, just to let you know one thing, both information regarding the advisory, Carrie did put it up on the chat. So just want everyone to know. Regarding the MTA right now, just to remind everyone, number one, the F and M trains starting this coming after Thanksgiving, starting on that Monday. There will be a service change that the F&M will be switching. So during the weekdays of 6 a.m. to, let's say, 8:30 p.m., if you normally go through the 63rd Street tunnel between Manhattan and Queens, that will be the M train will be running. And then if you normally travel with the M to 53rd Street, that will be the F train. Because the problem is right now is since the E and the M always delays of train traffic and there's been complaints, we are encouraging everyone to be aware of these changes. After hours and weekends, the F will resume back to its 63rd Street tunnel. This will be evenings, late nights, and weekends. The F will resume to Lexington through the 63rd Street tunnel. M trains will be, as you know, M does not run between Delancey, Essex Street, and Forest Hills. Please, everyone, as I mentioned this to the other boroughs, please listen to the signages and please listen very carefully because we have a lot of people wear headphones and not pay close attention. And this has been going out to the community on that. Second, as you know, the holiday is just around the corner. The holiday vintage train will be starting again, but not this weekend. It will be starting in December for the 5 weekends on Sunday. It will start at 2nd Avenue Housing, going uptown to 96th Street and 2nd Avenue. The schedules it's already been attached to Brian, and it's already been linked onto the chat as well. Also, as a reminder, please make sure you guys check your Omni accounts. Please, because this past Friday, Friday night to the morning, they were upgrading. So please make sure that your accounts are fully up to date and make sure you're checking your balance. And as a reminder, everyone, as you know that December is the last day for Metro cards, just to please be careful when you're going to use them. And just to remind you that starting the 1st, Beeline buses and Nice Bus will accept your Omni cards. If I get any additional updates, I will let Brian know and all the borough councils know as soon as possible. But as a remind you, please be mindful of when you're traveling during the winter seasons. And as a reminder to everyone, we are seeing more elevator openings. Tomorrow they're going to be, as you know, Church Avenue is open on the B&Q, which is early. It only took 1 year and 2 months to do. So please make sure you enjoy that station. Please also be alert. There will be a lot of new upgrade changes and service things coming up. And as you know, the fare will go in effect of a nickel or a dime, which does not affect your Omni budget because technically now if you're using Accessorite, you don't have to worry about the dime anymore. Then you can just give them the 3 singles or use your AAR Omni card. On behalf, wish everyone a happy Thanksgiving, happy holidays, and Brian, that's all I have unless someone has questions because I do see a chat question just popped up on my end.
I don't see any questions on my end, Chris.
No, it's coming to me on. It's somehow they send it as a private chat. It's like you know how they add the names in, but no at this time. So I don't see anyone has any additional questions for me. But as I said before, Brian, I send you all the attachments for the what's going on with the MTA. It's also, you should have the MTA board updates that should give you guys all the information you need to know and things that are coming up. Right now, ridership is fine and Accessoriters numbers are up. So just to be aware that, because I got one question. If you have not received your Accessorite Omni card, which is really called the AA Omni card, please contact Accessorite after Thanksgiving because we are seeing that the post office has been having problems with the mail. But as I said this in the beginning, since 2019 and 2018, please make sure that your home address is fully up to date. That's been going since I've been saying that since day one, when Lorenzo was the chair. So that's all I have at this time, Brian. Thank you.
Thanks, Chris. Any questions for Chris? All right. Angela, did you want to make an announcement or you just want to put it in the chat?
I can make an announcement. It's fine. Thank you. Good morning, everybody. First of all, I want to wish everybody a happy Thanksgiving. I was just going to remind the agencies that I have not met with for the FSS meetings. We're still conducting the reviews. So I just want to remind them to email me so we can schedule them as soon as possible. I'd like to have them all done by the end of December so that we can renew contracts for the next fiscal year, which will be 26, 27. And if you have to make any changes, we need to know about that as soon as possible. Maybe your fiscal person has left, maybe your coordinator has changed. So if you can let us know as soon as possible, we would appreciate it. And again, just thank you for all the guys that I annoyed to make them join your meetings. And for the Family Support Advisory Council meetings, I appreciate you guys joining. Thank you.
Thank you so much. All right. I believe at this point we can open it up for announcements. Again, you should also have your announcements in the chat because that all gets put on our website. But we can open it up so you can make a more public announcement. Just put the hand up and use the hand feature and I will call you as I see them pop up. So the first hand I saw is our friend Carrie from the Brooklyn Library.
Hi, all. Thank you, Brian. And thank you, Deborah, for announcing the fair. And just to let people know, I've put it in chat. And that's the Disability Resource Fair at the Mill Basin Library. I have 2 other things in there I think might be of interest to people. One is a repeat performance by Gary Schulman, who's coming back virtually anyway, to New York City, to Brooklyn, to present on needs, wants, wishes, and dreams, programs and services for children with disabilities. If you've not been to this before, please do come. If you have specific issues that you would like help with or specific needs that your families may not be getting through OPWDD or you know, think of this as the local, cheap, free Make-A-Wish Foundation. So please attend. Gary will be addressing individual needs and questions. Also, the ones he doesn't get to during the workshop, he always follows up on. And then secondly is our next in-person concert, free concert at the Brooklyn Heights Theater. This is a sensory-friendly concert sponsored by Music for Autism. And we have the outstanding cellist, Leyland Ko and Loa Cho. And you can see them on December 13th at the Brooklyn Public Library's Brooklyn Heights branch. And I just want to remind people that these concerts are a really incredible resource. They are free. They are for all ages. All you need to do is register. We do have some nice food at them, not lunch, but nice snacks or crudité. And I hope you come because it's a lot of fun. Thank you. Any questions? Cool.
Thank you, Carrie. All right, Sandy. All right, we'll come back to Sandy J.
Good morning, Jay Kleinman from LifeSpire. We have openings for in our Brooklyn Crisis Intervention Program. We do referral and linkage, short-term case management, all that type of stuff. And I've put my email address in the chat. So thanks a lot.
All right, thank you, Jay. Sandy, are you back with us?
I am.
All right.
Hi, everybody. This is Sandy Naper from Adapt Community Network, and we have two great webinars coming up. The first one is this Wednesday, November 26th, from 10 a.m. to 11:30 a.m. It's supporting emotional regulation in neurodiverse children, considerations and strategies for setting children up for success. Our speaker is Dr. David Meichenbaum, and there's information on this in the chat and a link to register. Our next one will be on Thursday, December 4th, 10 a.m. to 11:30 a.m. It's diagnostic assessment and behavioral interventions for children on the autism spectrum. We're having two clinical psychologists from the Seaver Autism Center at Mount Sinai. And you can also register with the link that I provided in the chat. And there are also flyers in the chat for these two webinars. And as always, we provide Mandarin and Spanish translation. So thanks, everyone, and have a great Thanksgiving.
Thank you, Sandy. Any other announcements? I'll make a quick one for my agency. Oh, no, Erica, go ahead.
Good morning, everyone. Happy holidays to all. We currently have openings, a lot of openings, more openings than we should have in our Sunset location. So please, if you know of anyone that is looking for a site-based program, we definitely are not turning anyone away. I say that, but I'm side-eyeing as I say that. But we definitely have a lot of openings in our Sunset program. So if you know of anyone that is interested in a site-based program in the Industry City area, please send them my way. My email contact information have been placed in the chat prior to. We do have a couple of openings in our East 98th Street location for Dayhab. We are starting a Without Walls in Brooklyn, so I am starting a wait list for that, as well as we always have openings in our respite programs, after school, in-home, etc., and our ComHab programs. Again, thank you, everyone, and enjoy your holidays.
And that was Erica from Heaven's Hands.
Sorry,
Erica,
yes.
Erica, this is Carrie Banks from the library. I have a quick question. For the Dayhab program in Sunset Park, what languages do staff speak?
English, Spanish, and I believe we have some Creole speaking.
Great. Thank you so much.
No problem. Thank you.
Brian, this is Chris. I have a question for Erica too.
Okay.
Erica, can you forward us the email of those service openings so I can add it to the website so it'll be ready for the resource fairs that are coming up? So I could just make sure it's up to date.
I can put something together to definitely send you. Not a problem.
Thank you. Happy holidays.
Same to you, Chris.
All right. Carrie, is your hand back up? Sandy? Oh, no, Sandy just went down. Okay. I believe that's all of our announcements. So just reminder again, we are planning an in-person legislative event, Brooklyn College, Friday, February 6th. More information will be coming out from Maria and Lucina. And we will not be having our general meeting in December, but our committees will still be meeting. So I will continue to send out email reminders, posted on our website. Go ahead, Pilar.
Hi, everyone. Just the update I did put in the chat. For the Meaningful Day and Employment Services Committee, we will not be meeting in December. We're going to take a break because most of the people that attend our meeting are school age people. And as we all know, the kids will be out of school. So we had a very productive meeting last week. For parent advocacy, we had parent to parent present. I think it was very informative. The recording should be up on the website. If Brian hasn't done it yet, he will be doing it. And we have the contact information for parent to parent. They are in all 5 boroughs. It's a parent organization that matches other parents with disabilities to support each other and access to services and information. And so our January meeting will be January 15th, and the expected topic is going to be employment services. We got a lot of questions about employment during our last meeting, so we're going to start with some employment things specifically as they relate to transition, but also additional employment questions and just kind of navigating what the different types of employment services are. As we all know, employment can be very complicated. So we're going to start off kind of with the basics intro, and then we will readdress employment again at the later dates. So I will be sharing out the flyer with the Zoom link soon for the January meeting. But just so you all know, we are not meeting in December. We're taking a break for the holidays, and we'll be back in January 15th.
Thank you, Pilar. And Rabin, go ahead.
Hi everyone, happy Monday. I just wanted to let everyone know that I'm the case manager for Brags, and we are accepting and assisting families who are looking for HHA services. And even if families who are looking to receive CDPAP, we are one of the facilitators in the state of within the 5 boroughs, as well as Westchester and Nassau County and Suffolk. We're able to provide CDPAP services. We have an entire team to assist with the PPL process. So in the event, there's anyone who is looking for assistance, and even with process of applying for OPWDD, I am available. I did add my information into the chat. So I'm looking forward to be of assistance. And thank you all. I really enjoyed this presentation today. I'm going to be passing this along to my families that I'm currently assisting. Thank you.
Thank you, Rabin. All right. I don't see any other hands or any other comments. So with that, we can end the meeting. Thank you, everyone, for attending. Have an amazing Thanksgiving. Have an amazing holiday season. We will see you at our next meeting in January, but please attend our committee meetings that will still happen next month.
And happy
holidays, everyone.
Happy holidays.
Happy holidays. Happy holidays, everyone. Bye.
Thank you. Bye-bye.
Bye.
Bye.